Hello, my dear friends. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today we're going to talk about the fifth cranial nerve, also called as the trigeminal nerve. Before we begin today's lecture, I want to introduce to you the concept of first, second and third order neurons. It's easy, but just for my satisfaction, I'm going to take you through that. Okay? Come. So you can see these people here on the screen. They're all holding hands. Okay, now that's the thing I want you to focus on. So imagine that there is some kind of touch. A receptor has picked up that touch. Okay, so when the receptor picks it up, it hands it over to the first neuron here. This first guy is the first neuron. Okay, this first order neuron now hands the information over, carrying it certain distance to the second order neuron here. Okay. This person now picks up that information, carries it for a certain distance and hands it over to this person who is the third order neuron. This third order neuron now hands it over to the cortex. So, what did we see? We saw that receptor picked up some information, handed it over to the first order neuron, the first guy. Okay. The first person picked it up and carried it forward to the second order neuron. Who picked it up and carried it to the third order neuron? Who carried it finally to the cortex? So whenever there is some sensation, it is picked up by the receptor, handed over to the first neuron. First neuron, axon, carries it to the second order neuron. Second order neurons, axon carries it to the third order neuron. And third order neurons, axon carries it to the cortex. This is how information reaches your cortex. Okay. So these are the three order neurons in any sensory pathway. There can be less, there can be more as per the pathway, but commonly there are three. Right. So take a look at this beautiful diagram and you will get it. Okay. So now this is the first order neuron. This is the sensation being picked up here, handed over to your first order neuron, which axon of the first order neuron carries it into the brainstem, hands it over to the second order neuron. These two dots are the second order neurons. The axons of which carry and hand it over to the third order neuron, this green one, which carries it and relays in the cerebral cortex. So sensation from here used how many neurons? First, second, third. 3 neurons, okay, to reach the material or thought process or sensation to the cerebral cortex. It's just like a relay race, okay. That's how cerebral cortex is able to sense the sensation which is sent to it. Right. So with this basic information, let's begin the fifth cranial nerve. It's a large nerve, there's a lot to discuss, and this is the entire pattern along which you discuss any cranial nerve. Okay, so do we read this? No. This is there for you to read. You can pause the video, you can read it. I'm going to begin teaching you along this format. So, let's introduce the cranial nerve. It's the fifth cranial nerve. It's the largest of cranial nerves. It's also called as the trigeminal nerve. See, these are things which are very easy. You know it, but you must write it in your paper in case you are writing a descriptive answer. What type of nerve is it? It's a mixed nerve. It is having sensory portion also and it's having a motor portion also. It has two roots, a motor root which is quite small and a sensory root which is quite large attached to the trigeminal ganglion. Where is it attached to the brainstem? Now close your eyes and try to imagine the brainstem. If you remember, at the lateral edge of the pons, at the junction of pons and the middle cerebellar peduncle is the origin of the fifth cranial nerve, okay, externally on the ventral surface of pons. So what have we covered in this one slide? We've introduced the trigeminal, we've given it another name, we've understood that it's a mixed nerve containing motor and sensory roots, and we've also attached it to the ventral surface of pons. Right. So let's talk about the origin of the nerve. The origin of trigeminal nerve can be divided into deep origin. Which nuclei does the trigeminal nerve remain attached to? What are its nuclear origins or nuclear attachments? And the secondly, superficial, which we just discussed, external attachment. Very important that you also understand the deep attachment. Therefore, two origins, deep origin, superficial origin. Deep origin means nuclei to which the nerve is attached. Superficial is the part of brainstem to which the nerve is attached. Let's first discuss the deep origin. Which are the nuclei to which your trigeminal nerve is attached? The trigeminal nerve consists of 4 nuclei of brainstem. Okay, one is a one motor nucleus and there are 3 sensory nuclei to which your trigeminal is attached. What are the 3 sensory nuclei? Spinal, principal sensory, mesencephalic. This looks like a lot of material, lot of data. Best to understand using images. Come. I'm going to first orient you to this diagram. Okay, it's a beautiful diagram. You're going to love it. Okay, so what you're seeing here is a rather fat brainstem. Okay, so here you're seeing medulla, the pons, the midbrain. See, the labels are there for you to orient yourself. This is the thalamus here and this is the cerebral cortex. And this, my dear friends, is your trigeminal ganglion. Okay, so I'm going to show you what are the nuclei to which our trigeminal nerve is attached. So, this in the middle, you can see 2 square boxes which are the motor nuclei on either side of midline. Remember always in your brainstem, motor nuclei are found medially. Sensory nuclei are found laterally. Similarly, here too, you're finding the motor nucleus here. And there are 3 sensory nuclei placed one above the other. Okay. So here you have mesencephalic nucleus. Below that, principal sensory nucleus. Below that, spinal tract nucleus. So how many sensory nuclei? 3. What are they? Spinal tract nucleus, principal sensory nucleus, mesencephalic nucleus. How many motor nuclei? 1. Where is it? Placed medial to the sensory column. See, this is the sensory nuclear column. Medial to it is the motor nucleus. Clear? So, these are the 4 nuclei which are forming the deep nuclear origin of trigeminal nerve. So, let's talk a little bit about each nucleus. Right. So, this is a section, okay, through the pons. Here you are seeing the motor nucleus of trigeminal nerve, okay. Taking origin from the motor nucleus, the axons from these neurons emerge out to form the motor root of trigeminal nerve, supplying 8 muscles. Which 8 muscles? 4 muscles of mastication. What are the 4 muscles of mastication? Masseter, temporalis, medial pterygoid, lateral pterygoid. Then it also supplies 4 other muscles. What are the 4 other muscles? See if you can remember. Okay. So, motor nucleus supplies 8 muscles, which are, these are the 4 we've already done. What are the other 4? Tensor velli palatini, tensor tympani. 2 more. Anterior belly of digastric and mylohyoid. 8 muscles. You should know them like the back of your hand. At any moment of time, anybody asks you what are the 8 muscles supplied by trigeminal nerve, you should know all 8. You should not hesitate in answering these. Okay? Right. So, that's the motor nucleus. This nerve, the motor component of trigeminal nerve, is the nerve of first arch. Okay? So, if it's supplying the first branchial arch components, then it has to be which functional component? It has to be a branchial efferent component. It's a branchial efferent component. Whenever any nerve supplies the branchial arches, it's a branchial efferent component. So, that's the motor nucleus of trigeminal nerve. Let's talk about the spinal nucleus. Remember, spinal nucleus extends from the lower end of pons down into the cervical segment of spinal cord. Okay? It receives pain temperature. Just imagine that you have maybe some kind of a injury on your face. How is that injury going into your cerebral cortex? Your trigeminal nerve is picking it up, relaying it in the spinal nucleus of trigeminal nerve, because that is the nucleus that is made for receiving pain temperature from your face. And then I'll tell you the rest of the story. Just remember, pain temperature from your head neck region goes to spinal nucleus of trigeminal nerve. From here, the sensation will then be carried to the sensory cortex. How? Come, let's take a look. So I want you to orient yourself to this beautiful diagram. Okay. Remember my instructions right on the top. Follow only the blue fibers. Don't follow other fibers. Only the blue fibers. Okay. Right. So that's the spinal nucleus of trigeminal nerve, and that's the sensation of pain temperature in your face. Okay. Now it begins to travel backwards. As it travels back towards your brainstem, the neuron who is first receiving it, your first order neuron, lies in the trigeminal ganglion. Okay, so here, first order neuron lying in the trigeminal ganglion. Neurons, dendrites have received the sensation. Now for the cortex to understand it, the sensation has to pass through the axons to the spinal nucleus of trigeminal nerve. So follow the axon here and see how it relays into the spinal nucleus of trigeminal nerve. The nucleus has received pain temperature from the face. What will it do now? It will hand over the sensation to the second order neuron in the nucleus. Second order neuron picks up the pain temperature and now begins its race towards the cortex. How does it do that? It crosses over to the opposite side, ascending upwards as the trigeminothalamic tract. Trigeminothalamic tract. So where is it going? It's going to the thalamus. Very nice. So you can see that here is your thalamus. These blue fibers have now gone and relayed into the thalamus, into the third order neuron. Third order neuron has received pain temperature. Now it begins to run through its axon towards the cerebral cortex. Okay. So that is how your cerebral cortex finally perceives sensation of pain and temperature, which was started in your face. Okay. So spinal nucleus is situated at the level of pons, extending down to the upper cervical spinal segments, receives pain temperature. Can you tell me the tract similar to the spinal tract of trigeminal nerve in your spinal cord? Who carries pain temperature in your spinal cord? I'm sure you know this answer. Lateral spinothalamic tract. Very nice. So lateral spinothalamic tract carries pain temperature for the rest of the body, and spinal nucleus receives pain temperature for only the head, face, neck. That completes pain temperature from the entire body. Okay. So if it's receiving pain temperature, what functional component will it be? One, I know it will be an afferent. Which afferent will it be? It is a general somatic afferent. Your face is basic. The sensory sensations coming from your face are general somatic. So it's a general somatic afferent nucleus. Let's now move to the next component, principal sensory nucleus, lying almost on top of the spinal tract nucleus of trigeminal nerve. Remember, it's a sensory column. So lower down you saw spinal tract of trigeminal. Just above it you see the principal sensory nucleus. Again, what does it receive? Pain temperature is done. What is there to receive from your face now? Touch your face. What is that nice gentle touch that you feel? Touch, pressure. Okay. How do you feel this beautiful sensation that you have on your face? Your face is so full of sensations, isn't it? So how do you feel it? Who receives it? Who carries it to your cerebral cortex? Principal sensory nucleus carries it. Okay, come. So situated at the level of pons, it receives sensation of discriminatory touch. Keep two fingers on your face. Can you tell that they are two? Till what point can you tell that they are two? How close are the fingers going to be before you cannot tell that they are two separate points of touch? All that is principal sensory nucleus. Okay. Right. From here, the sensation is now going to be carried to sensory cortex. Again, question how? Come, I'll show you. So again, we come to the same diagram where you can see the midbrain, pons, medulla oblongata, the thalamus and the cerebral cortex. By now you're used to it and you know this is your trigeminal ganglion. But this time you're going to follow green fibers. Okay. So now just imagine that this is your principal sensory nucleus and there is a touch sensation on your face. Maybe it's your mother who's come back from work, you're sleeping, and she gently just comes and kisses you and goes away to get on with her household chores. But you, even in your sleep, have felt that gentle touch and you have felt it, noted it in your cerebral cortex. How did a sensation from your face reach your cerebral cortex and get perceived as touch? Okay, come, let's follow that. So, there is that little kiss on your cheek that gets picked up by the first order neuron lying in the trigeminal ganglion. This carries the axon of your neuron, carries it to relay in the principal sensory nucleus, wherein there are the second order neurons lying here. Okay, these second order neurons now pick up that sensation of touch and carry it across, ascending upwards to the thalamus as the trigeminothalamic tract. Remember, spinal tract also formed trigeminothalamic tract. This one also enters into the same trigeminothalamic tract, going from trigeminal to the thalamus, trigeminothalamic tract. Okay, and finally this sensation is now handed over to the third order neuron, which is lying in the thalamus, which carries the sensation to the cerebral cortex, and finally your cerebral cortex perceives that sensation of touch on your cheek. You got it? So, touch picked up by receptor, carried to the first order neuron in the trigeminal ganglion, relayed to the second order neuron in the principal sensory nucleus, relayed to the third order neuron in the thalamus, and relayed to the cerebral cortex. And finally, there is perception of touch. This is how touch is carried from your face to your cerebral cortex. Okay, so this is what we did. Again, a question. What are the functional components here? Since it's going from your face to your cortex, it's a general somatic afferent. Question. Can you tell me a tract similar to this in the spinal cord? Who carries discriminative touch from your spinal cord? Of course, it's the dorsal column tracts, fasciculus gracilis and fasciculus cuneatus. So, discriminative touch for the rest of the body, fasciculus gracilis, fasciculus cuneatus. Discriminative touch for your head neck region, trigeminal nerve. Which nucleus? Principal sensory nucleus. Clear? Okay. So we now come to the mesencephalic nucleus. So where is this nucleus? This nucleus is in the midbrain, in the periaqueductal region. It receives the sensation of conscious and unconscious proprioception. Now I'm going to tell you something. Turn your head any which way, okay? Like I'm going to turn it like this. All right. Do it, do whatever you want with your head neck region. Remember, head neck region. Now ask yourself, do you know the position of your head neck region? Or do you have to look in the mirror to understand it? You know it, right? How do you know it? You know it because there are proprioceptors who are picking up this position sense and relaying this into your sensory cortex as well as cerebellum, so that your brain remains aware of the position of the head neck region. Which nucleus is involved in this? The nucleus is the mesencephalic nucleus. Come, let's understand the last nucleus. Same diagram. Ma'am, we are used to this now. I'm glad you're useful. See if you can practice drawing this. It's actually very easy. It looks like a lot of, squiggles, but it's actually very easy. I hope you draw it. Maybe if I get time, I can release this diagram sometime for you as a drawing label. It'll help you. Right. So, midbrain, pons, medulla oblongata, thalamus and cerebral cortex. This time, which fibers are we following? The red ones. Right? So, now, this is your mesencephalic nucleus, and some kind of conscious and unconscious proprioception is being picked up from your head neck region. the fiber, as you can see, does not relay. It's very important. It does not relay in the trigeminal ganglion. Did you see that? It just passes through trigeminal ganglion without relaying to relay into your mesencephalic nucleus, which therefore is the first order neuron. This is important. It comes as an MCQ. This is the only first order neuron found inside the CNS. All first order neurons are always lying outside the CNS. Okay, this is the only one that lies within the CNS. Now the axon of first order neuron carries the sensation via the trigeminothalamic tract to the thalamus, wherein lies the second order neuron, which carries this to the cerebral cortex. So conscious and unconscious proprioception follows the method of cerebellum. Cerebellum usually receives tracts which have usually only two neurons. So this is what we are seeing, the first order neuron, which is the mesencephalic nucleus, and the second order neuron lying at the level of thalamus. So how are things different here? See, the fibers pass through trigeminal without relay, which is not the same with the other fibers of trigeminal. They all relay there. These fibers carrying conscious and unconscious proprioception do not relay in the trigeminal ganglion. First order neuron therefore lies in the mesencephalic nucleus of trigeminal nerve. Note MCQ. Axons of first order neuron then cross midline, traveling through the trigeminothalamic tract, finally relaying in the thalamus, and from there into the cortex and cerebellum. So can you tell me tracts which are performing the same function in spinal cord? Who is carrying unconscious proprioception from the spinal cord? And think, anterior and posterior spinocerebellar tracts. Who is carrying conscious proprioception? The dorsal column tracts. So this job for the head neck region is done by the same nucleus, the mesencephalic nucleus. Okay. Which component is this? By now you should know it's the general somatic afferent component. Okay. So the peculiarity, again note, normally first order neurons lie outside CNS. This is the only place where first order neuron lies inside the CNS in the mesencephalic nucleus of trigeminal nerve. Right. So now this diagram is showing you motor nucleus of trigeminal, principal sensory nucleus, and here the mesencephalic nucleus of trigeminal nerve. Okay. You have to imagine that the spinal nucleus is a little down and therefore not seen in this section. Fibers from the motor nucleus emerge out medially, forming the motor root of trigeminal nerve. Fibers from the head neck region through the trigeminal ganglion are coming back into the brainstem, together forming the sensory root of trigeminal nerve. Some fibers, of course, will relay in the spinal nucleus, which is not seen in this diagram. So, fibers which are emerging from motor nucleus form the motor root. Fibers which are going to the other thin nuclei form the sensory root. And this is how there is a thick nerve formed, which is called the trigeminal nerve, attached to the ventrolateral surface of pons. Got it? Okay. So, with this we come to superficial origin of pons. You can see it here at the junction of pons and the middle cerebellar peduncle. Emerges at the junction of pons and middle cerebellar peduncle here. Has two bundles, medially the motor root, laterally the thick sensory root. It forms a single trunk that begins to now travel forwards. So what did we learn up till now? Let's quickly revise before we go forward. We've learnt about the introduction, another name for the nerve. What kind of nerve is it? It's motor, sensory, both. Then we talked about the deep nuclear origins and the superficial origin of trigeminal nerve. Within the deep nuclei, we talked about motor, spinal, principal sensory and mesencephalic, all four nuclei. We talked about first order, second order, third order neurons, trigeminothalamic tract, and then we talked about the superficial attachment of the nerve. So what is left to be discussed? Is the nerve done? No. So now what happens? The nerve is going to pass forwards and begin its distribution in the face. And this is a lot of theory about it. Do we read theory? You can read theory, but I won't read it. Okay, I'm going to show it to you with the help of diagrams. So here's your trigeminal nerve, sensory root, and the green dotted line is the motor root. Okay, here's your beautiful trigeminal ganglion, and you can see the nerve dividing into its three components. What are the three components of trigeminal nerve? Ophthalmic, maxillary, mandibular. Ophthalmic leaves through the superficial, ophthalmic leaves through the superior orbital fissure, maxillary leaves through the foramen rotundum, mandibular leaves through foramen ovale. All of us know this. This is basic fundamental knowledge. If you don't know it, pause the video, revise once. Okay? Right. So, trigeminal nerve, motor root, sensory root, orient yourself again. Okay? Trigeminal ganglion. V1, V2, V3. V1 is ophthalmic division. V2 is maxillary division. V3 is mandibular division. Ophthalmic leaving through superior orbital fissure. Maxillary leaving through foramen rotundum. Mandibular leaving through foramen ovale. You have to know this. Okay. Now what happens? Come take a look. We will now discuss in brief the distribution of each of these. Okay. And of course the motor distribution as well. So these are the three branches of trigeminal nerve. Let's talk about the ophthalmic division. Ophthalmic means it's going to come into your eye, right? So it passes along the lateral wall of cavernous sinus and finally divides into three branches. Passing through the superior orbital fissure. What are the three branches? See if you can remember them. Frontal, nasociliary, lacrimal. These are the three branches, okay? So all this is too much, isn't it? Come, I'll show you how to remember it. So this is your beautiful cavernous sinus, okay? And here is your ophthalmic division of trigeminal nerve running along the lateral wall of cavernous sinus. I am telling you that if you begin to revise using diagrams, it becomes so easy that you don't have to mug it up. Just look at the image and you're never going to forget that ophthalmic division of trigeminal runs along the lateral wall of cavernous sinus. Now you can see that it is dividing into frontal, nasociliary and lacrimal. These are the three branches. Okay. So what happens to the frontal? The frontal passes forwards into the orbit, dividing into supraorbital and supratrochlear nerves. Nasociliary passes forwards, gives a communicating branch to the ciliary ganglion, dividing finally into anterior ethmoidal nerve, posterior ethmoidal nerve, long ciliary nerves, infratrochlear nerve. Lacrimal travels laterally, receiving a branch from zygomaticotemporal nerve. So this is very difficult for us to remember all this. Again, use a diagrammatic representation to understand. Come. Same diagram, but this time we're going to use it to understand. Okay. So that's my frontal nerve. Can you see it dividing into two? Supraorbital, supratrochlear. Say it once. Supraorbital, supratrochlear. Frontal nerve done. Remember, these are the same nerves that emerge out from the orbit and go and supply your scalp. Okay? Right. Now let's talk about the next nerve, which is nasociliary, passing through the ring of Zinn. Now this is the nerve that gives rise to the following nerves. Infratrochlear nerve, anterior posterior ethmoidal nerve. See, these are anterior posterior ethmoidal nerves. This is the infratrochlear nerve, okay? And then you can see the long ciliary branches. Can you see them here? And you can see one branch going to the ciliary ganglion, which is giving rise to short ciliary branches. The image will help you. Pause the video, draw it once, okay? And this is the ciliary ganglion. And finally, this is the lacrimal nerve, which is receiving the zygomaticotemporal nerve and finally supplying the lacrimal gland as well as the region of your eyeball laterally. Okay. So that's your ophthalmic division of trigeminal nerve. Please use your diagram well. It's made specifically so that you remember your ophthalmic nerve well. Now let's talk about the maxillary division. Maxillary division again has all this theory. Runs along the lateral wall of cavernous sinus, leaves the skull through the foramen rotundum, enters the pterygopalatine fossa, has the pterygopalatine ganglion suspended from it, and finally leads to the infraorbital fissure. Now it's called infraorbital nerve. Do we remember all this? Images. Okay. So now again the same diagram, okay, cavernous sinus, and here is your mandibular division again running along the lateral wall of cavernous sinus, okay. So out of pons, dividing into three, ophthalmic is done, maxillary. Both ophthalmic and maxillary are running along the lateral wall of cavernous sinus. Right. This time, this diagram will help you. That's your maxillary nerve. That's the foramen rotundum. It's passing through it, okay. I've taken great pains over this diagram. Do appreciate the effort because I really want you to understand this. Right. So see, it's passing through foramen rotundum, emerging out into the pterygopalatine fossa, okay. And in the fossa, now, that's the maxilla, that's the pterygopalatine fossa here. And then that's the superior orbital margin, your lower margin of maxilla. That's the infraorbital foramen. Important. Now let's understand what happens. That's the maxillary nerve, gives rise to one meningeal branch and then passes through foramen rotundum onwards to the pterygopalatine fossa. Where it suspended from it is the pterygopalatine ganglion, okay. It passes through the floor of the orbit, emerging out through the infraorbital foramen as the inferior orbital nerve. Okay, this inferior orbital nerve right here in your face is a direct continuation of the maxillary nerve. Parallelly, it gives rise to zygomatic nerve, which joins with the lacrimal nerve to go and supply the lacrimal gland. Rest of the maxillary nerve gives rise to posterior superior alveolar nerve, anterior and middle superior alveolar nerves, which are together supplying the upper upper entire teeth. Okay, upper 16 teeth are supplied by these nerves, posterior, middle and anterior superior alveolar nerves. So that was your maxillary division. Please go back and revise it once. It's not possible for us to remember everything in one go. Finally, we come to the fantastic mandibular division of trigeminal nerve. Why is it fantastic? Because it's the thickest and it's the most often discussed. It's the mixed portion of trigeminal nerve. The other two were purely sensory. This one is a mixed portion. It has a motor component and a sensory component. Together, these components pass through foramen ovale. Note, motor is set of axons from motor nucleus of pons. Sensory is the third branch of trigeminal ganglion. Right. So let's talk about branches from the mandibular. Very, very commonly asked. Do please revise it. So from the main trunk, some branches are from its anterior division, some branches from posterior division. So what do we understand? That mandibular division gives rise to some branches from its main trunk. Then it divides into an anterior division and a posterior division. Anterior will give rise to 3 motor, 1 sensory branch. Posterior division will give rise to 3 sensory branches. I'll give you the details. Come. So from the main branch, it will give rise to a meningeal branch called as nervus spinosus. You know, it's like you're coming out in a hurry from the hostel room. You're in a hurry to come out. So you come out of the door, you lock the door, and then you realize, oh, I forgot my pencil inside. The same thing happens with trigeminal. It comes out of foramen ovale. I want to go and, generally create havoc in the face. But it forgets to supply the meninges. You can't do that. You have to supply the meninges. So what it does is, the first thing it does is gives rise to a meningeal branch of mandibular nerve, which passes back into the cranial cavity through the foramen spinosum. Deal done, supply given to meninges. Now it's free to give rise to branches. Another branch it gives rise to is the nerve to medial pterygoid muscle. Okay. This nerve then gives rise to a branch that goes to otic ganglion, which also supplies tensor tympani and tensor veli palatini. You have to remember all this, okay? Revise it a couple of times, it will come to you. What about anterior division, posterior division? Anterior division gives rise to 3 motor branches. That means 3 nerves that supply muscles. Which muscles? You know that trigeminal nerve gives rise to supplies 8 muscles. Okay. So the 3 muscles supplied by this anterior division are nerve to masseter, deep temporal supplying the temporalis, and nerve to lateral pterygoid. So did you see that? Nerve to medial pterygoid, tensor tympani, tensor velli palatini, masseter, temporalis, lateral pterygoid. 6 muscles are already supplied by mandibular nerve. It gives rise to one sensory branch, which is the buccal nerve, which spreads out in this region. Okay, so one sensory branch goes inside and picks up sensations from your oral cavity. So it gives rise to your buccal branch. Now, what about the posterior division? The posterior division gives rise to 3 sensory branches: auriculotemporal, inferior alveolar, and the lingual. Auriculotemporal going to your parotid, inferior alveolar supplying the lower alveolar margin, the teeth, and the lingual supplying the tongue. But this inferior alveolar gives rise to one motor branch, which supplies the last 2 muscles, your mylohyoid and your anterior belly of digastric. Now, this is a lot of data. You're going to have to revise it quite a few times. So, I have created a diagram. I hope you can use this. Okay. So, see. This is your trigeminal nerve, and that yellow branch is the motor root. Okay, that's your trigeminal ganglion. These are the branches of trigeminal nerve: V1, V2, V3. Okay, and this is the motor root traveling with the V3 or the third mandibular division of trigeminal nerve. So let's see how the mandibular division emerging out of foramen ovale first gives rise to a nerve to the meninges, meningeal branch of mandibular nerve. Then it gives rise to nerve to medial pterygoid, which also supplies the otic ganglion and then goes on to supply tensor velli palatini and tensor tympani. Now it divides into an anterior division and a posterior division. Okay, so let's begin to understand each of these. The anterior division here gives rise to nerve to the masseter, masseteric nerve, deep temporal nerve supplying temporalis, and nerve to lateral pterygoid supplying your lateral pterygoid muscle, and the leftover nerve is your buccal nerve. Okay, so 3 motor, 1 sensory. Clear? Let's now go to the posterior division of trigeminal nerve. This is wonderful. I hope you enjoyed. It gives rise to the auriculotemporal nerve. See how beautiful the nerve is. Can you see it's creating a little loop here? See, it forms a loop like this through which your middle meningeal artery passes. If you are good at dissection, do please try this. You will be able to see this beautiful relation. Okay? And you will get that kick out of the dissection. I hope you get that. Right. Continuing, this is the lingual nerve. See how it receives the chorda tympani. Together they travel forwards, passing beneath the submandibular duct to finally distribute in the tongue. And this last one here is your inferior alveolar nerve, which is of course, like I said, distributing itself along the inferior alveolar margin and the teeth there. It gives rise to a nerve to mylohyoid that also supplies your anterior belly of digastric. So this beautiful diagram, which may look complicated because of so many arrows, forget the arrows. Just draw it a couple of times and you will have your mandibular nerve in hand. It's so easy, but you have to practice drawing it. Again, I think I'm going to try and release these drawing labels for you so that you are more comfortable with understanding these simple topics. Okay. So that's the trigeminal nerve. Remember branches of mandibular nerve using a single diagram. Revise with me. That's the trigeminal nerve. That's the trigeminal ganglion. Dividing into V1, 2, 3. Is that clear? Okay. This is the motor route that travels with V3. After passing through foramen ovale, the mandibular division gives rise to a nerve meningeal branch, which passes through foramen spinosum back into the cranial cavity to supply meninges. Now it gives rise to a nerve to medial pterygoid, which gives rise to a branch that supplies the otic ganglion, also supplying the tensor velli palatini and tensor tympani. Now the mandibular nerve divides into an anterior division and a posterior division. Anterior division supplies masseter, temporalis, lateral pterygoid, and finally forms the sensory buccal nerve. Posterior division gives rise to auriculotemporal sensory nerve, which forms a loop for the passage of middlemeningeal artery. Gives rise to lingual nerve, which receives the chorda tympani, passes beneath the submandibular duct to supply the tongue. It then gives rise to inferior alveolar nerve, which is again a sensory nerve. Gives rise to one branch, which is nerve to mylohyoid, which also supplies the anterior belly of digastric. Right. So what did we learn up till now? We've talked about all this. We've talked about the course, the trigeminal ganglion, 3 divisions of trigeminal nerve, discussion about each division, ophthalmic, maxillary, mandibular. Let's now talk about the applied aspects. Okay. So here you're seeing a patient in excruciating pain of trigeminal neuralgia. What is it? What is the possible treatment? Okay, these are things that should come to your mind. That is, alcohol is injected into the trigeminal ganglion to reduce the amount of pain. Sometimes surgical resection is done of the inferolateral part of the sensory root to reduce the pain. Okay, why do we spare the V1 fibers? Okay, so let's discuss. Trigeminal neuralgia. What is it? What are the treatment options? All this I am not going to discuss. I'm going to leave this on your screen for you to pause and study this. Okay? Why spare the V1 fibers? Again, I'm going to leave it to you for you to understand. Just remember, the question here is, if you were to completely destroy the trigeminal ganglion, it would stop fibers which were carrying supply from you, carrying sensations from your cornea. You'll have corneal anesthesia. Would you want corneal anesthesia? Would you not damage your cornea if it does not have a sensory component there? So that is why you have to spare the V1 fibers when you're doing anything to treat trigeminal neuralgia. Who is the most famous case of trigeminal neuralgia? Unfortunately, Salman Khan, who's had a lot of pain of this disease and who has been smart enough to be very vocal about it and spreading awareness about this disease condition. Right. Lingual nerve is closely related to the mandibular nerve. Where is it related? It's related close to the junction of the inner surface of the ramus of mandible and the body of mandible. Why does it become important in case of molar tooth extraction? Lingual nerve passes very close to the medial surface of mandible, near the third molar region, just beneath the mucosa. Why is it important for molar tooth extraction? Because during surgical extraction of mandibular third molars, you may accidentally injure the lingual nerve. Damage leads to loss of general sensation and taste along the anterior two-thirds of the tongue. You will also have tingling numbness of the tongue and floor of the mouth. Which nerve can be damaged in case of fracture of mandible? It's the most commonly is the inferior alveolar nerve. Why? Because inferior alveolar nerve enters into the mandible by passing through the mandibular foramen. Right. How do you give anesthesia for tooth extraction? Where is the anesthetic injected and why? Can you see him giving her anesthesia? Answer to this question. Inferior alveolar nerve block injected near the mandibular foramen. Also sometimes the lingual nerve gets anesthetized. Okay. Why is this site important? Because the nerve enters into the mandible here. All the mandibular teeth on that side will get anesthetized. Easy tips to revise trigeminal nerve. Use diagrams. Come, I'll show you how to use diagrams. Draw diagrams. It's up to you. I'm going to try and release related diagrams. Hopefully that will help you. See, this is the diagram of V1, that is ophthalmic division of trigeminal nerve. Just draw it and you will never forget the nerve. That's the maxillary division. And that's the mandibular division. We've revised twice on the mandibular division. So hopefully these three diagrams itself should get you the trigeminal nerve like this. Applied aspects, of course, I've given you some theory which I have not discussed much because I need you to pause the video and study it. Everything cannot be spoon-fed. You also need to use your brain. Okay, so I hope you do that. And of course, feel free to put in doubts in the comment section and I'll revert back to you, helping to clarify your doubts. Thank you, dear students. Separate drawing videos will be uploaded about how to draw the various aspects of trigeminal nerve of ophthalmic, maxillary and mandibular. That's it for now. I'll see you in my next video. Bye.